Assalamu alaikum everyone. Today I will demonstrate you a typical rib. The third to ninth ribs are typical in nature because they bear common features upon them. So you hold the bone like this. The posterior end having head, neck and tubercle lies posteriorly. Anterior end having a concave depression lies anteriorly downwards and slightly away from the midline. The shaft is twisted and directed obliquely downwards and forwards. The costal groove in the shaft is directed inferiorly. This is the costal groove. The features: the posterior end having a head, a neck, and a tubercle. The head is divided into superior part and inferior part by transverse ridge. The inferior part with articulate will be articulating with the corresponding vertebra. The tubercle having a rough part and a smooth part. The rough part is for the articulation of transverse process of corresponding vertebra, and smooth part is for the attachment of ligaments. The anterior end is concave, having a depression for the attachment of costal cartilage, which is a primary cartilaginous joint. The shaft is twisted and forming angle of the rib. It possesses a costal groove. The costal groove having a outer lip, inner lip, and intervening floor. The outer lip will give origin to the external oblique muscle, which is converted posteriorly the posterior intercostal membrane. The floor of the costal groove gives origin to the internal intercostal muscle, which is converted into anterior intercostal membrane anteriorly. The inner lip of the costal groove gives origin to the innermost intercostal muscle, which is prominent in the middle two foot. The neurovascular bundle consists of intercostal vein, intercostal artery, and corresponding intercostal nerve will pass through in between the innermost intercostal muscle and the internal intercostal muscle. The articulation takes place with the vertebra is the plain type of synovial joint. The head is articulating with the vertebral costal demifacet like this. The upper portion will articulate with the superior vertebra. The costotransverse joint is also a plain type of synovial joint, and there are three ligaments attached to the smooth part of the posterior tubercle of rib: the anterior costotransverse ligament, posterior costotransverse ligament, and lateral costotransverse ligament. Thank you, everyone.